Do not want to use fillers, only Botox for permanent frown lines. Is it possible? I am 38 and have deep, permanent, static frown lines between my eyes, which I have noticed getting worse over the last few years. I would like to start Botox treatment. However, I am nervous about using fillers, which I know helps with the static etched-in lines. Is it possible for a significant improvement to be noticed in the static etched-in lines a period of time, could be years, while using only Botox?
Thank you for your question. You're 38 years old and you're asking if you can make a significant improvement in the static lines between your eyes, which are by using Botox alone. And you stated in your question that is it possible to make a significant difference over years without using fillers, which you are aware are beneficial for static lines? Well, I can certainly give you my perspective on this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I was one of the first group of doctors to use Botox back in the mid-90s. And so this question is certainly very relevant and has a place in terms of what kind of effect it'll have in relevance to your questions. So, in the absence of a photo, it's a little bit difficult to answer the question in the absence of a physical exam. But I will give you some idea about what the effect of Botox is on these lines. So to begin with, let's be clear on definitions. Dynamic lines are lines that occur when you activate muscles. So when you frown, which is what you're describing frown lines that with repetitive action of the muscle caused an etching of the skin, and those lines we refer to as static lines. Now static lines are there at rest, which means even when you're relaxed and you're not frowning, those lines are present. So, from my perspective, when someone like you comes, yes, when I look at someone, I always think of a global approach to helping them see improvement. Because the challenge is when it comes to these frown lines, or often referred to as number 11 lines, people have an objection to them and want to do something about them is because they always appear to be angry. And so if you think about it, if the Botox is used and you relax the muscles and the static lines are still present, you may still give the perception or create the impression that you're angry. Now the fact that you're willing to be patient and wait over years is definitely meaningful. There is no question that with continuous use of a neurotoxin, Botox, Dysport, Xeomin, anything that relaxes a muscle, then the skin is no longer being creased and those lines can soften. So to answer your question, it's likely that you will benefit from just using Botox alone. But there is some exception to that. As you get older, genetically, you're going to lose collagen, you're going to lose fat volume, you're going to lose soft tissue volume, and this area can still become deeper. So, a lot of times in my practice, what I tell patients is, Botox will be your first step. Let's see how you do with Botox and do it consistently. Typically, people come for Botox injections around every 4 months. You do those injections and you stay consistently with it and see how things look. When you talk about these layers of skin, there's opportunity to do other things that maybe you're concerned about that can be an alternative. For example, we use platelet-rich plasma in our practice to build up the collagen in the dermis. So this is technically not a filler in the traditional sense of the word, because this is derived from your own blood. Using your own blood and using the growth factors that are necessary for wound healing that stimulate collagen is often an alternative that a lot of our patients really embrace because they like the idea it's natural. In terms of other options for this area or other areas of the face, you can consider non-ablative or ablative lasers. These are things that are all part of the many solutions that are available to you that you can work with your doctor to customize. In the meantime, I think it's safe for you to at least move forward. A lot of times people want to figure out everything that they need before they go to the doctor, and they do a lot of research. And the reality is that there's so many options and there's so many opinions. It's very hard for a person who is not a physician who's in this field to really be able to come up with a game plan that is likely to succeed for them. And in fact, you'll go to different doctors and you'll also get different opinions. So it's optimal for you to actually meet with doctors and find a doctor that you'll be comfortable with, because it really makes a difference for a doctor who gets to know you, know your skin, and know what works for you, and have records of your photography and see and show you how you've been progressing over time. And so this is something that I think you're off to a good start since you've learned a lot and you've thought this through. But start by seeing how this works out for you. If you feel like after a certain amount of time you want to do something more, there are additional options for you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.